Hi there, this is Dr. Jason Tripp. Today we're talking about our brain therapy. So if you have a child who has ADD or ADHD, which is attention deficit disorder or attention deficit with hyperactivity disorder, then I can tell you that there are answers that maybe you've never heard of. It's a therapy that's been around for almost 50 years and it's called neurofeedback. Basically, you're going to use a cap to test that brain. You can measure if the brain response is weak or if it's too strong. If it's too strong, you got to calm it down and get it relaxed. If it's too weak, you got to bring it back up to balance. When you balance the brain waves, the body functions better, the mind functions better. The child can focus or concentrate or not lash out with behavior issues or anger problems. Like all of that starts to come down. Specifically, when you look, there's many different varieties of ADD and ADHD that you can literally pick up and see on the brain map. So getting that brain map really helps us to be able to tell exactly what's going on. But you can look on the brain map and it'll tell you if you're a low alpha, then you're going to lose motivation. But if you're a high alpha, that's when the emotions can't be controlled. And that's when sometimes these anger swings come through and those sort of things. So there's a lot more that you can do with somebody who has ADD or ADHD than just medicate. So many times we're told, well, here's your medication. What else can I do? Nothing. There's specific exercises for each portion of the brain depending on where it's weak at. So you can be doing brain therapy, you can be doing at-home exercises. There's nutritional things that you can do. We found that over 90% of all of our ADD, ADHD patients had at least one deficiency where they were deficient in a nutrient. And so if you're deficient in a nutrient that affects the brain, you won't be able to focus or concentrate. And so a lot of cases, that's what it is. We've also found food sensitivities to be huge for people who with ADD or ADHD. I've not had a single patient who had ADD or ADHD that did not test positive for at least one food sensitivity. Now, food sensitivity is unlike food allergies. If you have a food allergy, you eat the peanut or the lobster or whatever and your face swells. But when you're talking about a food sensitivity, your face doesn't swell or those kind of things. Instead, you end up having a reaction to it that maybe is in your gut and maybe a week or two later. So you're not going to notice it right away. So we have to look for these on specialized testings. And in certain percentages of those same people with ADD and ADHD have a heavy metal toxicity. The heavy metal toxicity can cause your body or your brain to either go too heightened, which is when you get the hyperactivity, or where it lowers it, which is where you get to where you can't focus or concentrate. And so remember, there can be a problem with the brain waves, delta, beta, alpha, theta, etc. There can be a problem with nutrition deficiencies, that kind of thing. Neurologically, we check for nerve damage in the spine. That's another one that's in there. You can look for that on neurologic testing as well as body testing as well as x-rays. You can actually see where the misalignments might be causing it. And then there's food allergens and heavy metal toxicity. So if you have you or a loved one suffering with ADD, ADHD, doesn't have to be childhood, even adults who have ADD or ADHD, you can get relief, you can get help. But you need to be addressing these 5 things that we just talked about for ADD and ADHD. So I want to encourage you, if you're struggling, to give the office a call, 724-342-2225, and ask about the ADHD severity exam so we can find out what's going on in your body and with your brain to see if we can get you better. If you have any questions, you have any comments, put them in the section below or call the office and set up a time to just talk to me. Just to find out some more information. We'll give you anything that you need. So this is Dr. Jason Tripp, and I'm looking forward to talking to you.